beyond. Heat.a1fm.com and iHeartStation.
Nancia, Smokehouse, it's the urban heat. Shout out to Coach Live.
Coach Allysa, time to listen to conversations that's gonna keep you winning. Sunday nights at 10 p.m. on the urban heat, just call it. Conversations with Coach La 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 La. Coach La 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 La. If you got something on your mind, you can call in, you can hit a line. She the realest, ooh, she the realest. You can tap in loud, oh, get a business to empower you so that you can do every and anything that you want to. Kicking it with Coach Allysa, time to listen to conversations that's gonna keep you winning. Sunday nights at 10 p.m. on the urban heat, just call it. Conversations with Coach La 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 La. Coach La 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 La.
What's going on, beautiful people? Welcome to another episode of Conversations with Coach La La La, your favorite around the way therapist. How y'all doing? It's gonna be a jam-packed show. You know we always are moving and shaking. Yes. So it is Easter Sunday. So happy Easter to everybody. I hope y'all got some treats from the Easter Bunny. How y'all feeling out there? Did you eat well? Did you get time to spend with your family? Shout out to everybody who's tuned in and listening to the show tonight. I know holidays can be tough, right? And you know, holidays are not always, everybody doesn't embrace them, and not everybody celebrates Easter. So for some people, this holiday means absolutely nothing, and they are just fine with it. And to others, this is a big deal. So to everyone, to make sure I include everybody and make everybody feel special, no matter what your orientation is, right? So it's a Sunday. I want to give a big shout out to my poetic brother, Mr. VCR, the living legend. Today is actually his birthday, and he had a poetic birthday performance at the City Winery. Heard it's a jam-packed show. So happy birthday, VCR. I'm so sorry I couldn't make it, but I did send some people. And from what I could see on the live, you did your thing, my brother. So I know you guys didn't come to just hear me say happy birthday to everybody. I know you came because it's time to get on the couch, the virtual couch, that is. Tonight's conversation is going to be an integrated one about the intersectionality of our identity and how all of that plays into who we become. And I found these two beautiful women, one because one of them did a pitch contest at the Grind Pretty Fest. And I'm telling you, her fit was something to see, ladies. And her personality shined through. And I said, I never heard of her organization. And I said, she's somebody I need to know. Because I'm always supportive and encouraging, especially my women of color who enter the mental health field. We got to support each other and be our sisters' keepers. And I said, you know what? My listeners need to know about them, and so does the community in Boston and beyond. So that's why I picked them. And then I found out not only is she in business for herself, but she's in business with her bestie. And you know how I feel about bestie friends that go in business with each other. So tonight's conversation is going to be two beautiful women of color. One is a Miss Allysa Cambra. I hope I said her name right. But girl, she got more alphabet soup behind her name than me. And y'all know y'all get on Coach about all of the letters behind my name, but this sister got a bunch of letters. A MSN, a AP, RN, I don't even know what that stands for. A PMHNP-BC. I know, don't even ask, right? But that's some serious alphabet soup. And one of the things, she's from New Bedford. Shout out to New Bedford. And one of the things I loved about her story is that she actually has had a passion and a heart for mental health since the age of 15, which we're going to learn a little bit more about that. And now, as for her bestie, this Caribbean sister has grown up on the outskirts of Boston, baby. And I'm telling you, these sisters is not only beautiful, but they got brains too. And I'm not going to mess her name up because I've been practicing, right? Nicolette, Quashie. She's shaking her head and nodding. I got it right. Go, coach. So she's also a psychiatric mental health nurse practitioner as well as Miss Allysa. I just think that is an amazing thing. And also, she also has had a passion for mental health since her early years as well. I don't want to give everything away, but these two ladies have founded an organization called Silver Lining Integrative Psychiatry. Now, if you know anything like I know, just the idea that it says psychiatry is a big deal in our field. And being two women of color is also a big deal. And they have a space, which a lot of people don't have, where you can actually go in and meet with someone face to face. And I think that is super, super awesome. So I want to bring these two beautiful sisters on stage, and I want you guys to welcome them to Conversations with Coach La. What's up, ladies? Oh, wait a minute. Let me turn y'all's mics on. I'm a little slow. One more time for the audience, y'all.
Hey, guys.
Hello,
How you guys doing?
Now we have liftoff. Now, you know, I have said so many great things about you already, but one at a time. What don't people know about you that I didn't share in your bio that you want them to know that's going to really make them see a different side of you? We'll start with you, Miss Nicolette.
So for me, I think my personality, I think everybody thinks that I am outgoing, which I am. I'm very much outgoing, a life of the party in small settings and gatherings, but I actually have a lot of anxiety, social anxiety that a lot of people just don't get or understand. Like even doing the show right now is taking me out, but I like to get out of my comfort zone. So I feel like it's a surprise to everyone when they're like, you're so outgoing, like very colorful, very like just out there. And I'm like, no, baby, it takes a lot to like get me in these spaces, but I think I'm doing a good job. So
girl, you doing a good job. Girl, you doing a good job. Come on, say it with me, girl. You
doing a good job. Girl, you doing a good job. I'm gonna have to show that with my clients.
Little positive affirmation there.
Absolutely. So next up is Miss Allysa. Tell us a little bit about yourself and what don't the people know that I didn't share in your bio?
I would say people don't know. Well, you did mention that I did the grant competition for Grind Pretty, and I wouldn't say I have social anxiety, but that event I was very, very, very nervous. It was my first time doing a pitch contest at all. So I was super shocked like everybody else when I won. And so that kind of gave me a little bit of fuel to come and do ventures like this. And I want to just continue to grow and expand and kind of be the face, myself and Nicolette, of mental health, especially in Massachusetts, but eventually through the country, honestly. I'd like to be like the representation for people that, you know, want to relate to somebody that looks like them maybe in this field.
For sure.
Yes, I think that was amazing. Again, you know, you guys are tuned into Conversations with Coach La right here on the Urban Heat 98.1 FM. Make sure you guys go to the website and subscribe. I am Coach La, your favorite around the way therapist. I got so excited that, you know, I just took for granted that maybe some new listeners that have never ever met me before. But when you have great guests in the audience, you just want to jump right in. So ladies, tell us about the start of creating Silver Lining Integrated Psychiatry. Your motto is you may slip, but you won't fall.
Yes.
Talk to us about that, because I think that motto is super dope. And I thought about mental health, and I thought about often people just have these pauses, these hiccups, and you need support. And that's what I thought about the slip. And I said, what a great way to frame that. But what inspired that?
So, I mean, it started off, so we're both nurses. We've been nurses for 10 years. We graduated in 2014 and started working right away, all in hospital settings and doing traveling and such. And so I think for us, we wanted to be able to create a space that was very personalized and individualized to our character, to our culture, to our like experiences. And, you know, living in Boston, unfortunately, there's not that many spaces for us, and being in the hospital, not that much, especially in big corporate world hospitals. And so I think the idea of just like creating something that was safe for us, you don't know how many times our clients come in and I can just see the stress, anxiety, come off of them because they're like, okay, it's somebody that I don't even have to explain my struggles to. They understand it. I don't have to break it down. Just doing the nursing and just being able to go to school for the 2 years and get out and just be like, you know what, I want to be able to be our own boss. And we really took a leap of faith. We left most people do it where they'll be at the bedside still, and like while they're trying to build their clientele and get their foot out in the door. We kind of took a leap and just did it all the way. Like, I was like, we're leaving the bedside that way. We have no choice but to make this work. And so, while we don't have clients when we first start off, we're going to be doing content. We're going to be putting our name out there. We're going to be letting them know that we're here. We're open. We're educated. You can trust us. And so, yeah, I think where you say you may slip, but we'll never let you fall, that's where it comes from. We just put our all into it in making sure that we create a space for our people.
And what about you, Allysa? What's your thoughts on that?
So we actually, coming up with our company name, let me tell you, we spent 6 hours at the beach one day, just like running names through, making sure that we weren't stealing anybody else's name or like infringing on anybody else's trademark. Because we're both Tauruses, we're both like by the book and we don't mess around, especially when it comes to business. So first of all, it took us multiple hours. Then we came up with Silver Lining, one, because we just wanted to give a name of like hope and of finding the good in things. And if people don't know, Silver Lining is like when there's a cloud and the sun's coming behind it, there's that silver ray of light around it, because even in like your darkest times, there's always something that we can find. There's something to hold on to, something to have hope for. And especially in the mental health community where a lot of people feel hopeless or like there is nowhere to turn to. We literally wanted to be that silver lining for them. The integrative part of our company is that we don't just do traditional psychiatry. We like to bring in a holistic approach to care. So we consider nutrition, lifestyle, your work environment, your home environment, incorporating your family. It's integrative. So we want mental health is all aspects of your life that have to come in play. So that's where we came up with that. And then Nicolette actually came up with the slip, but don't fall part. And then she said, we can't put we'll never let you fall, because people be ready to sue you. So we have to say our goal is to never let you fall. Yeah. But we're right here with our patients all along the way.
I love that. I love that you have created a space for people to feel fully supported in their mental health, and it's integrated. So part of that is holistic, and you're using different modalities and different approaches.
Mind, body, soul.
Yes. And I think that the difference that I haven't seen, which made me want to talk to you too, is the psychiatric nurse part, which you hear that more in inpatient, but you don't necessarily see that on an outpatient level, which I think is really important. Not everybody needs inpatient care, but they still need that wraparound sort of approach that's still very medical and still feels like a doctor's office. And some of the things that I don't offer as a psychotherapist, being a licensed independent clinical social worker, you guys also can prescribe medication. Right?
Yes, we can.
So I think that's super dope to see two Black women that can also prescribe. So tell me, how did that happen? Because not everybody wants to prescribe meds.
Right. So I think, that's why we did a video actually on our social media to show the difference between a psychiatrist, a therapist, and a psychiatric nurse practitioner. I think we did really well as far as like letting you guys know that like the therapist, you can talk, which is great, but there's going to be a point where sometimes your emotions is not going to be enough to handle the talk, that you're going to need a little bit of a boost. So that's where we come in, where we can do, prescribe some medications, and also, like sometimes they're prescribed in the inpatient, and then in outpatient, they want somebody to follow them to be sure that these meds are actually working. Because with some of these medications, it takes a couple of months or weeks before they actually start to work, and they do have some side effects. So just to have somebody in the community outpatient monitoring the patients, I think is great. And then as far as the psychiatrists, there's a lot of psychiatrists. Oh, no, there's actually not enough psychiatrists. And they don't have that much availability. So where we come in is we fill that gap, because we can do the same things they can do. They just done a little bit more schooling, but essentially we have the same role in the sense of being able to diagnose and medicate. And so back to the whole having space for us, just looking at like historically, minorities don't really like medication, or doctors. Honestly, they don't trust doctors. So when I have a client that comes in and, maybe they went to an inpatient place talking to a doctor and they're very skeptical, but when they come and sit in my office and I do the simple thing of just explaining to them why I would prefer them to be on this medication and what it would do for them. The simple fact of me looking like them, I get the trust.
Yes.
And that was the goal of it all, was to let our people know that you don't need to be afraid of doctors. We don't just want to get your insurance money. We like literally are here to help, and we're here to treat. And some of these medications do help. And we've learned about it, and we've, we want to be a voice and a vessel to let these people know that, like, hey, like, it's safe. It's going to help you, and you can trust us, and we'll follow you within the community to be sure that we're doing this all right.
You heard that right here. I told you guys, I always bring information, knowledge, and resources to really dismantle the myths about mental health. And one of the biggest ones is around medication. Now, everybody doesn't need medication, but sometimes you do. And sometimes it can be really helpful. I have a lot of clients that are very resistant to that. And even after so much talk therapy, they're still not necessarily having the results or the improvement, and just simply working on their thoughts and talking things through and processing. They're still having a lot of somatic symptoms that sometimes you need medication to support. So tonight's conversation, everyone, because it's season 7, as you saw, and what you heard, for those that are watching and someone's listening, I brought 2 powerhouses with expertise to help me dive deep and talk about unpacking the past and healing from within. And tonight's conversation is all about identity and the intersectionality, the layers of who we are. And often all of those things sort of play into our perceptions, our beliefs, our values, and ultimately our mental health. So ladies, let's kind of dive in deep. Tell us a little bit about your backgrounds in terms of ethnicity, culture, race, like where you both from. I know we talked already that you're Caribbean, but there's a big diaspora of Caribbean. So tell us a little bit more about what that is for both of you.
Okay, I'll go first. So yes, I'm from New Bedford, and I am actually Portuguese, Native American, and Cape Verdean. So my Native American side, I actually don't really have too much connection with that, only because I didn't really grow up with my dad's side of the family. My Cape Verdean side, even, again, I didn't grow up with my dad. My mom's parents and her parents died when she was young, so we again got kind of removed from that culture. So surprisingly, I actually grew up around a lot of Hispanic people. Most people, when they see me, think I'm Hispanic, and for a long time I actually really identified with the Hispanic culture.
She did.
So I did, and
she made me call her the Puerto Rican princess.
If you didn't tell me you were Cape Verdean, initially I thought you were a
Latina. Exactly. I get that a lot, and I love it because I love my Latinas. Shout out all the Latinas out there, and Latinos. But as I transitioned into my adulthood, I met my fiance, who's also Cape Verdean, and I really got to get more into my Cape Verdean roots and learn my own culture. So for me, I've actually faced a lot of complexities in kind of finding my identity, because I've always felt, to say, not that I just didn't feel like I was just white, but I didn't feel like I could say I was Black. And I know a lot of people struggle with that, because I don't present with traditional Black skin. So a lot of people kind of feel like I'm imposing on the culture, but I'm really not. That's in my blood. That's in my generations. My kids are going to carry that with them. So sometimes I struggle. Well, now I'm not, but over the years, I did struggle with can I say I'm Black? Can I not say I'm Black? And then I had one person told me that they just said, are you Black? Without anyone else's opinion around you, without what you look like, do you identify with that culture? Is it in your blood? And I was like, it is. So I carry it forward with me, and I say it proudly.
Good. I think that's a great point, that often when we don't present what people think we should present, you'll get that pushback that, you're not Black, because you don't completely fit in with the Black folks, and you don't really completely fit in with the Cape Verdean side, because you haven't grown up around it. You don't know maybe the language, the culture, the tradition. So it's where do I fit?
Truly.
So I'm glad you said that. What about you, Nicolette?
So my parents are from St. Vincent and the Grenadines. That's on my mom's side. And then on my dad's side, Trinidad and Tobago. And I've actually done my ancestry where I've gone deep, and I'm Nigerian and Ghanaian. And so I've actually really tried to within the last 3 years, get really immersed in that culture. But as far as Caribbean, I definitely identify as a Caribbean, but growing up in Massachusetts and just living on the outskirts of the inner city, because I feel like most Caribbeans were back then in the inner city. I think it was hard for me. I jumped around from school to school systems, and it was mainly the burbs, Woburn, Newton, Cambridge, Malden. Those are like the school systems I went to. I struggled with a little bit of being called like an Oreo, like, okay, like you're a Black girl, but you speak very well. And, I do listen to myself. I'm like, damn, I do sound like a white girl a little bit sometimes. So, but like, yeah, I think that might've been my only, but as far as like, I've definitely embraced my culture. I've always been like, I always go back to my countries, and my parents definitely don't ever let me forget about it. So, I never really struggled with an identity situation, more so just being in the school systems or so, like just having to code switch and such. But I'm learning now that that's why I created our own space, so we don't have to code switch.
Right. And I think that's a necessary coping strategy in a lot of ways. It's a survival mechanism to be able to code switch. I think sometimes we have to reframe that in terms of like looking at there's a time and a place for everything. One of the things I learned in school was like I had multiple identities and I got to choose, what role and what identity I wanted to lead with. And it was the one that empowered me the most. So in certain spaces, leading with just being a Black woman and everybody say it's a Caucasian male may not put the most empowered stance given society's pressures and connotations and different stereotypes. But if I go in as a licensed independent clinical social worker who has a master's in business, that's going to make me feel a lot more empowered that I know what I'm talking about. I'm going to walk with a certain kind of poise and a certain kind of grace, knowing that I have my credentials and I have my education to sort of lift me up in that space. You can't take that from me.
Nope.
Right. And I can't do anything about being a Black woman walking into a space because you can see it.
Yeah.
So I think all of that is so important. So you mentioned that you didn't really struggle with identity. But we mentioned code switching, and we also mentioned sounding like a white girl.
Right.
We got to talk about, right? So
right.
Like, that's not always seen as a positive.
Right.
That's like microaggression. Why can't I, as a woman of color, speak eloquently and articulate my words without you saying, oh, wow, you sound really smart and articulate for a Black woman, or you sound like a white person. Like, I don't know. That sort of makes me cringe a bit.
Yeah,
it definitely does.
So
definitely does.
Coming up, how did you feel hearing that? That didn't make you feel away?
I think, unfortunately, not until recently I realized that that probably was a problem, being able to create my own space, and that I'm feeling so like natural and normal in the way that I show up for myself at work versus when I was in the hospital setting. You don't know how many times I'd walk into a patient's room and like, one, they would think that I'm the cleaning or the janitor or like the CNA. And then once I introduce myself as the registered nurse, I can see their whole like body language switch up and like, oh, and what school did you go to? And like, now it's like, I got some type of respect or so. Unfortunately, I think it just was something that I allowed to just like not be a problem. But now I'm seeing that like, no, that absolutely was a problem. And that I'm glad that I was able to reflect on it and now make this space a space where I don't have to do such.
Yeah, right. When I think about that, I remember being, because I didn't start off as a psychotherapist. So I started off in financial services, a fully licensed financial service representative with all of the credentials in that field too. And often having to feel like I needed to sort of dumb it down and or not be so loud in that space, because often my counterparts that were white didn't have the same credentials that I had and wasn't passing these exams on their first try. And I remember I passed the Series 7. Shout out to everybody who has a Series 7 out there, right? And I was so excited. And I remember coming back to the office and one of the white managers met me at the door and was like, I know you passed, congratulations, but I'll never forget her name. I won't say it on the air because I'm not going to give her that much credit. But, blah, 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 didn't pass. So could you just keep that a little quiet and be a little less,
dim your light.
Dim my light. Wow.
Light was like real blatant. And I so many microaggressions that I dealt with being a woman of color in a predominantly white space with people with all different socioeconomic status, because everybody that was white didn't have money that was working there. But the assumption often was if you were white, you had money.
Right.
And so a couple of white women told me, it's like, you just got to act like you don't really need this job and like you have money. and they just will think that you do.
That you
And I was
gotta
like,
like
I
that.
learned a lot of little things from them.
Yeah.
Because she was like, oh girl, we poor too. We came from the hood too.
Right. I'm like, okay.
But people just didn't know that. So
Yeah. I have actually a quick story that's similar to that. As far as being in a predominantly white institution and not being like understood or heard. So I had a patient who was trying to take their own insulin, and I was giving him insulin as well too. And so I told him like, no, you can't take this insulin. We're going back and forth. I end up taking it from him, and he got upset with me, and he was like, what's your name? Like, I'm going to report you. And then he's like, never mind. It's probably like Shaniqua or something. Ooh, it took me back. It really took me a lot. So I was so upset. So I go into my manager's office, who's a older white woman, very sweet, love her to death, honestly. And God bless her soul, she really didn't know. So I'm telling the story and I'm explaining to her, and I do like the whole ball drop of the Shaniqua, and she's just listening, looking at me like, and what else? And I'm like, wait, no, that's the problem. She goes, wait, Nicolette, what's a Shaniqua? And I was like, I got mad all over again. I'm like, here I am, like thinking I can come to you and vent and talk. And she just didn't even see
it went
right over her head. And I was like, this.
And that's someone in a position of leadership, which it's to no fault of her own, but it just goes to show how unsafe so it is to be in certain environments.
So I had to go in the bathroom and call this one. And I'm like, girl, like they got me messed up over here.
Right. Like they have really no clue often about the microaggressions or how what they're saying could be inappropriate. Yeah. It's like those we call it sneak
diss.
Or shade. You're throwing shade.
Right.
You don't even realize you're doing it. So I think all of those things, right, often, at least for my clients, and now you guys can tell me if you've experienced too, is sometimes those are the things that prompt them to come to therapy.
Yeah. Oh, absolutely.
Because they feel gaslit. They feel like they're crazy. They feel like this can't be real. Why is this affecting me like this? Maybe I'm too sensitive. I'm making a big deal out of nothing. But often it comes from feeling like you don't belong and you don't feel seen, and not really having anyone around you that can relate to what you're experiencing. And I also worked somewhere else where I was pretty much told it's really hard for us to get into these spaces. So just put your head down, be quiet, and get your check.
And be in like your best behavior.
Right. I didn't understand though, ladies, why I was going through all of those things at that time. And I don't know anybody out there in the chat because the Instagram is popping. Shout out to Instagram.
Hey,
shout out to my sister that's listening, to everyone on all of the platforms that tuned in right now to Urban Heat and listening to Conversations with Coach Lau. We really appreciate you for being here. But I remember just feeling like this can't be real, right? This can't be reality, that this is what I'm experiencing, and no one really understands the anxiety that came with that, the depression that came with that, and the impact that it had on my identity and my self-esteem, and me trying to figure out who I was and where did I fit in. So that leads me to my next question around the shift, right? When you decided, okay, I'm not going to work for anyone else.
Oh, yes. Best decision ever.
Baby, let me tell you.
And I'm going to go do my own thing. And I know we're going to talk about other bet on self moments, but I think when we think about how these different experiences can take from us, right? Either hold us back or can propel us.
Yes.
So how do you think things like that propelled you or held you back? That's the better question.
Okay. I would think how it propelled us is that we actually worked, again, we've been nurses for 10 years. We worked in the heat of COVID. We got ran ragged. And that I speak for all healthcare workers in general, especially in the hospitals, whether you're white, Black, Puerto Rican, we got ran down to like nothing during that COVID time. That really wiped us out. We've been working hard, working double shifts since we started our nursing career. And we just got to a point where we just felt like a number in these institutes, where it was like, if you want to take a vacation, not that, you can't just be taking a vacation every week, but you want to take a vacation, take some mental health time, take some time to yourself. It's no, you have to do this. No, you need to work this shift. You need to do that. And we were just like, this is so unhealthy that like there's nowhere for us to turn when we need time to really take care of ourselves. I always go with the motto, like when you're on the plane where they tell you must put your own oxygen mask on first to help people. So I just feel like you want us here trying to give our best care in these hospital settings to people, and you're running us ragged, running us short-staffed. staff, underpaying us.
Not getting breaks.
Yeah, like not getting breaks. Like we've gone, and nurses can speak to it, 12 hours. And I mean that without a sip of water. I have cried one time because my mouth was so dry and I didn't eat, I didn't drink, and I did not use the bathroom for 12 hours. Nope. So like those are the times I said, this cannot be the life that we're meant to live. Like my mom and dad and my grandparents worked way too hard for me to be running around like this.
Y'all
and
heard
then,
that, right?
And then no, seriously. And then to not really be able to afford anything. Like you cannot afford like a property in Boston as a nurse. I'm sorry. Unless you've been working 30 years.
Truthfully.
I'm so glad that we're, talking about these things, because this happens also for people who are working as mental health clinicians in different places, right?
Yep.
You have no control over who your clientele is, long hours, paperwork. Literally there is a lack of understanding about time.
Yeah.
Like there's only so many hours in the day, people, right?
Yep.
Most of us working 40 hours a week. That's 8 hours. If you take an hour away for lunch, now I'm at 7, right? And so realistically, if sessions are an hour, how many clients can I realistically see and do my paperwork without me doing longer than an 8-hour day?
And do quality work.
Yeah,
right.
Quality.
Literally horror stories of clients telling me that therapists are either no shows, they're leaving, they're falling asleep in sessions. And all I can think about is the fact that most people are probably burnt out, overworked, and just trying to do too many sessions.
Right.
So I think all of these things are true. As we're talking about mental health, as we're talking about, work-life balance, often there is none. Right. And then we have people like Elon Musk that are saying we should just work 24/7, keep the grind going, and not take any breaks. Anyway, that's a whole nother topic that I don't want to get into politically, but I just think that the American culture often is set up to just make you work until you die.
Truly.
So this is where we kind of come in to really remind people that you need to prioritize yourself.
Yes.
You need to take that time off. And we share a similar story. They didn't even know that we shared that part of what propelled us was not having access to our time to take care of ourselves. What prompted me to start my practice was I actually wanted a month off and told them that they didn't even have to pay me.
And they still said no.
And they were like, you can't do that. You're a leader and you're needed here. And I was like, you don't have to pay me. I just need the time off. I'm like, I really need the time. This was like right after COVID. I was helping run a company and I was exhausted from running both my company's company and my business part-time. And I'm a single parent. And I just needed to reset. And I was like, before I burn out, let me just reset. And I need longer than 2 weeks. I knew I needed longer than 2 weeks was not enough time. I need 4 weeks to be disconnected from all of this. They told me no. And I said, well, I don't know what you're going to do. I'm going to do it anyway.
Right.
This
wasn't a request. It was a notice.
And I was like,
I'm the other people
that I'm going to take a month off and you don't have to pay me. So what ended up happening is they then threatened. Well, they sent me a message and was like, where are you when the 2 weeks was up? And I said, I told you I was taking them up. And they was like, well, you can't take them up. We need you to come back, blah, blah, blah. And I said, you know what? I'm going to play my cards right, be politically correct. I'm just going to return. And they were walking like eggshells around me. Like I was going to go postal or something. And I was going to be unprofessional. Like I'm a professional woman. I'm not going to like
tearing the place down.
They were checking in with me a lot. I was like, you guys are doing too much.
Yeah.
I'm back. I get it. You needed me back. I'm here. You can stop doing all of that. And then they wanted to write me up. I said, oh no. I said, if you're going to write me up because I was the director of operations, then you need to put a statement in there that there is no policy or procedure for taking time off. I didn't do anything incorrectly, that I came to you and I asked. So what are you writing me up for?
Right.
I need a policy for it, and there's no policy.
And you came back. So what are we really talking about? I
write the policies, and there's no policy for it. Right?
Got him.
There's no policy for it.
Ain't no way.
Then she goes, well, if you went to your doctor and spoke to your doctor, then we could have let you take the time off. Why are you gonna say that?
Because baby, where am I going?
Instead of me coming back,
I gotta go to the doctor.
Now I'm gonna go to the doctor, tell my doctor that I wasn't ready to come back. And my doctor said, well, how much time do you need? And I said 30 days. Good. So now I presented that. You still don't gotta pay me. And so now
I got 30
for 2 months.
Right.
Yeah.
And then I decided not to go back.
Good for you.
Good for you.
Absolutely. You know what? That's how they lose good employees like that. When you're not willing to give people time to take care of themselves, they're not going to return. That's consistent across the board.
Yep.
And so shout out to my support system, because literally this was like a case analysis of whether or not I could go back.
Oh, really?
Or could I stay out? And I literally had to map out the pros and cons and whether or not I could pull it off.
I know.
And it was like one of the most scariest moments. I'll never forget hitting submit on that resignation
Yeah.
letter.
I hate when like my morals and finances have to like fight. I'm like, no, but this is just like what I have to do. I'm like, I hear you, girl.
My goodness. But the amount of anxiety.
Oh, yeah.
If I ever felt anxiety, I was like, oh, this is what my clients experience.
Yeah, like,
this is it.
Like that knot in my stomach was there for hours.
I know. It's the fear
But
of
I
the
bet-
unknown, but you have to take the plunge sometimes.
You
You
have to
know,
take
I
the
try to
risk.
tell people, not that everyone does have that comfortability to be able to take a risk like that, but like you have to take the plunge and bet on yourself. If you're gonna bet on anything in this world,
that,
it's
right.
on yourself. Like
Absolutely.
always.
I know they're jumping ahead, y'all, and I know we kind of taking y'all on a little roller coaster ride, but I think that all of these things are really, really important. And according to the American Psychological Association, the APA, y'all, because y'all know I like to use acronyms, but I'm giving y'all what it means. Individuals who feel their identities are not validated or marginalized are more likely to experience anxiety, depression, and trauma responses. So there's a reason why we're telling you all of this stuff. Because sometimes as Black women, especially, we're so used to being strong. We're so used to holding and doing
Being
so
resilient.
many different things, pushing through anxiety, pushing through depression, that we don't even recognize that we're struggling and that we need help
Mhm.
and that things are too much until it's too late and we're in the hospital or we're sick or, you
Right.
know, we have a complete mental health breakdown. So all of these things, you know, really are a reminder of why we're here, right?
Mhm.
And often we get people when they're right about to be burnt out or they're already full-fledged burnt out. So,
Right.
so let's talk about this, right? How does SLIPServices support individuals in navigating their identity-based cultural trauma?
So I would say we try to create an environment where, again, people feel safe. So our first thing is active listening as far as people's traumas. You can have the same exact culture as me. You can be from Trinidad and Tobago like Nicolette. Doesn't mean that our stories are even remotely the same. Even us as Black women collectively, we all have our own Black story, our own journey through Blackness. So we try to just do active listening. And that's hard for me. I'm a person, I want to talk, I want to chime in, and we put our assumptions on. So we listen and let them be the, you know, give the narrative of their story. You can't assume that even two people that face the same trauma are having the same result. So we listen, and then we always give affirmations. We make sure that people feel validated, that they're heard, that they are not just, you know, thinking that they're drama queens or the angry Black woman, or that they're just feeling victim. That's the thing. A lot of people try to like make you feel like you're the victim, and that's not always the case. And then we help people navigate it when sometimes maybe their thought process is leading them down that victimization road, and there's other strategies that they can use to get out of that.
Yes.
Love that. Could we say this together? On
Yeah.
the count of three, we're going to say we listen and we don't judge.
Yes.
1, 2, 3.
We listen and we don't judge. No, truly, judgment is the biggest part, because nobody's going to want to come and express themselves if they feel like you're already looking down on them or saying they're doing things wrong about their life. It's not about right or wrong. It's about finding better ways that work for you in the context of your world.
Yes. I love that. So I put up a definition for those that are watching. You can see it, but those that are listening. So intersectionality is the interconnected nature of social categories. And it's like race, gender, class, as they apply to a given individual or group. Overlapping systems of discrimination and disadvantage. So this is why it's really important, because as we just named, me, Nicolette, and Allysa all have different cultural backgrounds. Although all three of us look like Black women, it doesn't mean that we all have the same experiences, beliefs, or values. And that sometimes is where things get a little complicated, right? And that's why intersectionality is so important, because we often will make assumptions, right? And that's cognitive distortions. For those that don't know, go look it up. But we can make assumptions, and those things can lead to faulty thinking, can lead to
mistreatment.
It can also make you show up in spaces maybe not as your best self, right? Where you're always triggered and reacting and all of those things. So it's important to really take an assessment of all of your different roles and identities,
Right.
and which one of those roles make you feel empowered and which ones maybe don't. And I think that's a good place to sort of start. What do you ladies think about that?
as far as
I agree. As far as like finding what qualities are like working for you versus what aren't.
okay.
I think even so, as you are aware as a therapist, there's things like transference and countertransference.
Correct.
Yeah.
So you have to be aware of our own selves, of our own biases. Of you know, I might not even be the most effective therapist for somebody because I'm a human, and maybe I just strongly disagree with something that you're doing, or something. I'm just not going to be effective. I have to be aware of that to be able to help somebody. I have to be aware of my own identity and the things that I stand for, because I'm also one of the benefits of a private practice is we can't discriminate against patients, but there's certain things that we have to be aware of as far as like violent behaviors or things like that, or we don't have to accommodate. I'm not going to accommodate anyone that's doing violent behaviors to hurt anybody else. I'm all about helping people get strategies and get better, but we can also refer you to other resources. Well, some therapists might do that. So it's all about knowing your identity, what you stand for, but being open-minded, being willing to learn, being willing to accept people's different perspectives. So it is a balance. And again, we're all human. It's not perfect.
And being able to recognize when you're in a situation where it's like the counter-transference or the transference, and being able to be like, you know what, this just doesn't work for me. And both ends. Yeah. And just be able to professionally tell the client that, you know, this is better for you and I, that, you know, we separate or whatever the case may be. And then also recommend and give them resources. Don't just leave them hanging, and understand that like that was probably the better situation than to continue on just because.
So in layman's terms, we're talking about fit, right?
Yes.
And so
and therapeutic relationship.
I think when we think about the idea that a lot of people are looking for a therapist that looks like them. There can be a misconception about just because someone looks like you
that it's going to work.
Understand you. Right. So that's kind of why I'm bringing this up, because I think we kind of get all lumped in.
We do.
Right?
Yeah,
and
we do.
I just want a Black therapist. Right. And so I have had some clients that, although we both were Black, their lived experience and my lived experience
were
so different. My interpretation of what they were experiencing, I was still wrong.
Yeah.
Even being a Black woman, I wasn't totally getting it.
It's actually funny that you say that I was just I changed my insurance, so now that I can get therapy. So I was looking for therapists, and I was telling Allysa, I was like, you know what? As much as I do want to go to a Black female, I was like, I think I want to trial out like a Caucasian female just to see, just because sometimes when we get into the spaces when we feel so comfortable, it becomes like you said, like, I don't know, that we're just gravitating to each other and like, yes, girl. And then like, we're not really hearing each other. We just assume that we know what's going on. And so I was like, I want to go to somebody who just doesn't understand the culture. That way I can get like a third party idea, and that they're not really just like yesing me and sis this and sis that, and really just get like a outside look as to like what I'm doing. Is this appropriate? Because sometimes we can just get very just like, you know, sisterly, too familiar. Yeah.
And it feels like a sister girl relationship.
Right.
One of my best therapists has been a white man and a white woman.
And you wouldn't intersect that.
And the reason why the white woman, she happened to be gay. She also happened to have a disability.
Okay.
So she was able to name that I was dealing with racism, and named it, and told me, and that was part of in session. She said, I need you to name it what it is. That you're being discriminated against. I need you not to minimize this and to do the strong Black woman thing. Right? Like, it is what it is. What you're feeling is what you're feeling. That came from a white woman.
Right.
Yeah.
Because that's true. I don't want to marginalize white professionals either, and act as if though they cannot help us in any way, because that also limits access across the board for people, because there are quality healthcare providers of all different colors, all different religious backgrounds. So I never want that to be the story either, but I'm glad that we are here. We are literally the access for people who want somebody that looks like them.
And I think from your social media and just even having this conversation with you right now, we are an exception, right? Like, every Black therapist is not the same, and just like every white therapist isn't the same. Everybody doesn't have the expertise. Everybody isn't going to listen and not judge. So when you're thinking about picking someone who's culturally competent, don't just base it just on how they look.
Right.
That's pretty much all I'm saying.
Agreed.
Right? Like, racial and ethnic minority groups are less likely to receive culturally competent care, but be mindful of knowing what your questions are and what kind of therapist you're looking for, because sometimes it may not be someone who looks like you that could be sharp as a tack and actually help you through a lot of different things. All right, switching this up, right? What patterns did you notice in your families or your communities that have shaped your views on mental health?
Okay, I'll start that. For me, I think in my culture, in the Caribbean culture, I feel like women are taught to be like kind of just push through, be resilient, very silent about like the struggles we go through. We're very much the nurturers, like the head of the household, and as far as being a nurturing, like a caring person. And so I think sometimes we just, that whole strong Black woman independent thing, we forget about that we, you know, we're human as well too, and that we need love and we need nurturing, we need caring, we need somebody to look after us. So I went my whole life just like kind of carrying that narrative and that role, and just in the Caribbean culture within the Black community, how mental health is really frowned upon. Like you're taught to pray through it or push through it, or that's the devil, and you know it's not real. So I just, you know, as I got older, made sure that I put myself out there and was like, you know what, I'm not okay, and I do need help, and I need to seek it, and I need to be a voice of it, and I need to make sure that other people know that, you know, they feel probably the same way that I feel, and just getting myself out there and getting the help that I need and that I deserve. So I think, yeah, just the whole being silent and strong, and now just showing that like you're not as strong as people may think you are.
You know, I think that's a common narrative. And, you know, Allysa, what do you think? And then I'm kind of want to segue to a follow-up, but what are your thoughts on that?
Similar in terms of like the strong, independent woman. I also want to just speak to like the masculinity culture too, especially in Cape Verdean or even Hispanic or Caribbean, especially for the men. I sometimes feel like they have it harder on the mental health aspect, where it seemed, I don't know where in the world it got twisted that you know, mental health is weakness and is feminine in some sort. And so I feel like a lot of men don't feel like they can speak up about feeling depressed, about feeling anxious without feeling like they're less than a man. And that's an unfortunate thing that I think I've seen across the board for people.
Yeah, like I heard they being called simps and like, oh, like you're just too emotional. And it's like, wow.
So patterns like that. And then also I think that we're also shifting, where mental health is such a big topic now, we're also shifting into an overdiagnosis pattern where it's okay if you're like sad for a few days. It does not mean you have major depression or, you know, anxiety is normal. Anxiety gets you going for your day. Like it doesn't have to have an anxiety
a lot of
disorder.
People do not meet the criteria for what they think they're diagnosing themselves. I'm like, you're having a hard time. You're having an adjustment right now. Like we're not going to put all these mental disorders onto you, and now you think that you're damaged.
Yes.
I think that's really important. There's a therapist account that I came across. I believe she's called the Capacity Coach, and she was talking,
I love her.
We love her.
She's amazing.
Yes,
so amazing. And she was talking about what we use our emotions now as a way to weaponize. We are also constantly talking about our feelings
in safe spaces,
and it's being used in a way now that's making people not have to really deal with discomfort or be held accountable. People are tiptoeing around. You can't call you out on your
flaws,
your flaws or your bull crap.
Yeah.
Right? Like somebody said, bring back bullying culture and some other things.
Oh no.
And I think that's extreme. But I think to a certain extent, we were sort of more resilient because we realized like everybody's not going to be first. You're going to lose.
Every day's not a good day.
Every day's not a good day. You just got the blues. You know, toughen up, buttercup. So some of the things we needed, but I think that we need balance.
It's a balance. All of that.
Either it was all the way over where you couldn't cry at all, right? Like it was like, stop crying, I'll give you something to cry for. But you just hit me, right? Like I'm crying because like, you hit me and you're telling me not to cry.
And now you're going to hit me again.
You're confusing me here.
And now I'm in the corner like.
So you got people that are like emotionally just dysregulated and confused.
Like how do I even?
For the first time, they're like, no, my feelings matter. And they're coming out. And then you have other people that really know you've been coddled all your life. And guess what? The world does not rise set to you
and fall at your feet.
And
exactly.
You need to allow other people to feel, and just because someone feels something or has a moment that they disagree with you, you don't need to block them, people.
Right.
Like we don't need to cut everyone off and be on this cutoff culture for everything. a friend can disagree and call you out, and you guys can still be friends.
Very much so.
We need to be able to have more of that. Every argument doesn't mean you're in a toxic relationship.
Oh my gosh, yes.
Everybody's not a narcissist.
Everybody's not a narcissist. Because you have good days and bad days doesn't mean you're bipolar.
Even just like trauma, like your mom yelled at you does not mean you like live this life of trauma because she said you can't have a snack at night. Like it's just, but everything is coming to that. It's very grandiose and like catastrophizing these days. So I feel like that's something I really try to emphasize with my clients or just people I talk to in general.
Yes. So your culture, your background, your values, and your view of the world sort of plays into a lot of how you interpret what's happening in your environment and how you respond and or react to it. So I think a lot of times sorting through that mental health diagnosis or not, sometimes people just need help with an adjustment.
Right.
You don't have this heavy diagnosis, and that's okay. Somebody recently asked me, she said, well, if I don't really have like depression and anxiety, could I still come to therapy? I said, well, if you're saying you're having a hard time with something, yes.
That's what we're here for.
Yeah.
Right.
But it doesn't necessarily mean that you're going to get diagnosed and you need to be on meds.
Right.
All right, ladies, we have made it to like the last 10 minutes of this.
Oh my God.
Really?
So fast.
I'm having fun. I just started having fun.
I told you. So let's move into the bet on self moment.
Okay.
As you guys know, my dad, God rest his soul, Kenneth Austin, love you to death, miss you so much, used to always tell me to bet on myself, primarily to step out of my comfort zone and be mindful of my environments and the people that I was around and to always know who I was, right? So these are moments in your life when you start to trust yourself, your voice, and lean into your power, right? And take those bold steps forward despite fear, doubt, or uncertainty. Okay? So tell us about some defining bet on self moments and your journey from bedside nursing to integrated psychiatry.
Okay, so like we said, we left the bedside with no real plan. Honestly, like the second week, I said, Allysa, what are we doing? Like, girl, like what? We didn't think this through. We often have a thing where we like
a little impulsive,
a lot of impulsive. We don't have no blueprint. We don't have nothing. We just be like, yeah, we're just gonna make it work. Like
no business background,
nothing. Like a thought comes in our head and we just want to go ahead and execute it. But with this, I was like, you know what? Let's just push forward. I feel like this was probably the better thing to do because had we kept the bedside job, I feel like we wouldn't put our all into all this. We would be expecting a check from the hospital weekly and kind of just relying on that or keeping on that. This is like, no, your finances depend on this. You got real bills, real life experience, and you love to travel, you love to eat. So you really got to put your all into this. So yeah, we took the leap with leaving the bedside altogether. And honestly, we left without even having one client on board. Okay, we opened up and was like, hey, we're here, and our launch was like on Psychology Today and Instagram with my 1,000 followers. Like so it wasn't like we had like this big master plan, but you know what, it's working out for us. Business is going great. Our clients are picking up every single day. We started to navigate as we, exactly what you said, bet on ourselves. On our days that we don't have clients, we're doing content. We're learning, we're going to conferences, we're getting education, you know,
doing we've never done this before. This is a bet on self moment.
Yeah. I'm like, girl, you signed us up for a what?
Yeah. I always sign us up for everything.
I love it. I so love this. This is so exciting. For everyone that's tuned in, you're listening to Conversations with Coach La with your favorite around the way therapist. And tonight I got Silver Lining. Yes, honey, we got a psychiatric, nursing facility that can diagnose and medicate you if you need a baby right here in Boston, Massachusetts. And guess what? They're telling us about their bet on self moment. I hope you guys are taking notes and listening, and I hope you're inspired by their story. Make sure you go follow them and check out their website, www.slip-services.com. So, Allysa, tell us your part. What's your bet on self moment?
My bet on self. So outside of that, I'd have to bring it back to me going to the grant competition. That was truly a bet on self moment. I was, when I tell you guys, shaking in my boots to go do that.
I'll tell you, her in the basement of my
test run
in my basement. I was like, baby, I don't know. You might have to go back to the drawing board.
It was not looking good. One, because I don't do public speaking. Two, sometimes sometimes I feel a little less confident because, like you said, we're baby practitioners. We just opened our business in February. So I'm like, who am I to get up here and act like I know the whole mental health world and all that? But really, it's in my heart. Like, I never knew it until we did this. I'm in my 30s now, and it's truly in my heart. And I'm like, even right now, Nicolette was nervous and she's here speaking so well. Like, it's really in us. It's our calling. I feel like it's our destiny. So I just feel like this is a bet on self moment. I feel like anything we continue to do and that we plan to do is us taking a risk. We don't know the outcome, but we're just like, we're going to take this chance and see where it takes us because we know we're here to help people.
Oh,
and it's very genuine.
I love it.
Yeah.
And you can tell, you know,
you.
Shout out to what's my girl's name? But she said it's either in you or it's on you or it's in you.
Yep.
Who Lotto, that's her name.
Oh, okay. My girl Lotto.
Yeah, Lotto. She was like, it's either, you know, it's in your baby. But actually, I think this Nipsey Hussle said that first.
Oh, originally.
Give credit to credit is due, but it's either in you.
Yeah.
It's on you or it's in you. And some people, it's just in you.
Yep.
Mm-hmm.
So we get nervous, but once we sort of settle in, it just flows.
It flows, yeah.
So like I told you guys, I had a whole set of questions, and I'm like, wait a minute. We kind of already said that one. Where we at
I
now?
know.
Wait a minute, let me catch up. But it's been great to meet you both and to really hear about your stories and hear about
thank you for having us.
where you're headed. So I have to do Coach's Corner, but before I do that, I want you both to talk about what's next for Silver Lining and what's your vision. And then I'm gonna close with Coach's Corner and your final thoughts.
Okay.
For me, the vision for Silver Lining, I see us open multiple practices all over throughout the country, not just in Massachusetts, as well as just being educators for other nurses and preceptors. I want to be sure that we're teaching the youth and just inspiring others to do the same as well.
Yes, I would say for us, as much as we want to care for people that are having mental health issues, we also want to be mentors to young nurses. We did, again, bedside nursing for 10 years until we got into this, until we took this venture. And I actually cringe that I did that for so long when there's such opportunities all out here for everybody to grab. So we want to get to the nurses young, do your time, get your experience. Everyone's got to, learn the basics, but then move beyond it. You can't work for these corporations and have them like running your life forever. Not everybody, but we want to just give people that opportunity. And then also just to let everybody know, we are working with our supervising physician and company, New Vision Healthcare, to hopefully establish.
Shout out to them.
Yeah, shout out to New Vision to hopefully establish a outpatient substance abuse recovery program in Randolph. That's going to be a big taking. We're like going through the state and all that to do it, but addiction's a big problem, of course, especially just like you look at Mass Ave. So we're hoping to have another available clinic, another location, more access for patients that need care, and hopefully help them in the recovery process with substance issues.
I just love all of this. This is really exciting. And I know you mentioned your age. We didn't talk much about it, but did you say 30?
I'm 33. I hate to say it.
And I'm 34. We're both Tauruses. Our birthdays are next month, May 6th and May 13th.
Yes.
And so
and that's Mental Health Awareness Month too. So
happy early birthday. But honey, let me tell you something. Y'all are right in the prime of where you need to be.
Oh, thank you.
So technically, you've already retired yourselves.
Okay.
Yes,
right?
ma'am.
When you look at it like that,
most people work, and at some point they go, I'm gonna work for myself after this age, and they're like much older.
Yeah.
So when you think about that, most people don't see retirement as I'm not working at all.
Right.
They want time freedom.
Yes.
They want the ability to do what they want to do, how they want to do it, and to not have to answer to anyone
Correct.
else.
Yes,
to call their own shots. So can we clap it up for?
Sure can.
Girl, you doing a good job.
Girl, you doing a good job. Girl, you doing a good job.
I'm gonna have to take that one.
I love it because more people have to understand that sometimes we have to take these risks.
Yes.
So that brings me to a new segment, baby. I love this segment because I get to talk my stuff. Coach's Corner, a moment where we can reflect, gather key takeaways, and leave with you with something to carry forward on your journey. What journey might you be asking? Some of y'all already know it's your bet on self journey. I'm trying to make sure the whole world knows that betting on self is not selfish. It's about knowing who you are and being willing to step out there and to go after your dreams unapologetically, right? And that doesn't mean that you can't still be working for someone else, because some people think that that's what I mean. That's not what it is. It's about really being key and understanding who you are as a person. So what is my Coach's Corner today, baby? So I want to leave you with this. Today, I want you to ask yourself, what parts of your identity are hiding or healing? I'm going to say that again. What parts of your identity are hiding or healing? Remember, it's not about perfection, because often we get so caught up in this idea of being perfect. It's about progress. When you understand who you are, you can reclaim your power. Betting oneself is all about believing in yourself, empowering yourself, and transforming the way that you think so that you can take action and take those shots. Because, baby, if you don't take those shots, you'll always miss. And you will never miss if you keep on betting on you. You will always be a winner. You're either going to have a lesson or you're going to get that win. Either one. It's always going to work out. Ladies, last closing thoughts other than, girl, you're doing a good job. Girl, you're doing a good job.
I would say my last closing thought is I just want everyone to truly know that healing, especially in our culture, is not a betrayal to the culture. Using the medications, the therapists, the nurse practitioners that are available to you is not a betrayal to your ancestors who fought through and were Miss Independent. Use the resources that are there for you. We're here for you. There's plenty of other resources, and
it's not a failure until you actually quit. So keep going, and
remember, you may slip, but we will not let you fall.
And we're located at 1 Frank Larry Way in Randolph.
Yes.
We're open. We have extended hours actually for the people who work
to
9 to 5.
people.
So we are open from 8 a.m. to 8 p.m. Monday through Friday. And that just allows you guys to have a lot more access, because we know a lot of places closes around 5. We offer we can do in office at that late hour as well, or telehealth, whatever you guys prefer.
Awesome. Thank you, ladies.
Thank you, guys.
Make sure you guys tune in for another episode of Conversations with Coach La. Next week, we're talking about the intersectionality of faith with Bishop Dickerson from Greater Love Tabernacle Church. Y'all have a good night.
Bye.
That's 857-400-90.